Why should you treat your total hip or knee replacement like buying a new car? In the next 6 minutes, I'm going to show you one simple tactic to start your search for the best surgeon for your total hip or knee replacement, even if you have no idea where to start, and why you might want to rethink your current choice of surgeons. If you'd like to know more about what you can do both before and after a total hip or knee replacement to get the best possible results, let me know in the comments below and I'll send you a link to our free total joint workshop. I'm Brad Logan, founder of Total Joint PT, and I'm your physical therapy specialist for total hip and knee replacements. I've successfully helped thousands of people rehab their new joint after surgery. In every video, I'm going to give you one tip or strategy that you can use to get the best possible results from your surgery. One of the most important decisions you need to make in the entire process before getting your total hip or knee replacement is choosing the best surgeon. Most people do tons of research when buying a car or a house, but when it comes to healthcare decisions, we often leave it up to someone else to make those choices for us, not even aware that there are options. Some of these options may be a much better choice for our personal situation, but we didn't even know those options were available. And I get it, making decisions about our own personal healthcare can be scary. We may not feel qualified and we don't want to mess it up and end up in a worse situation. But when it comes to successful total hip or knee replacement, selecting the best surgeon is one of the most important decisions you will make. When you select a surgeon, you're setting in motion a pathway that leads to your success or lack of. Every surgeon has their own way of doing things, their own criteria for success, their surgical technique, hardware decisions, skill level, level of support after surgery. So many important aspects of selecting your surgeon play a crucial role in how successful your final results will be. Now, what do I mean by successful? I measure success differently than a lot of the research articles. Research articles try to define successful outcomes by different metrics they can easily measure, like pain reduction, improved range of motion, return to independence, low infection rate, low complication rate, etc. I agree 100% that all of those metrics are very important, but looking beyond that, I want to see the definition of successful to include things like returning to sports you had to limit or give up because of your pain, returning to an active lifestyle, doing the things you love with family and friends, taking that adventurous vacation, getting back on the tennis court at a competitive level, out driving your friends on the golf course, getting back to full gym workouts. A truly successful surgery means that you are back to doing all the things that allow you to be healthier overall in a way that transcends beyond just feeling less hip or knee pain. And choosing the best surgeon is crucial if you want the best chance at what I would call a successful surgery. So, where do you start? Well, most people start with Google or Yelp if they're looking online, but online reviews are not always the best. Positive or negative reviews might not give you enough information to make the best decision. And some reviews might not even be legitimate. They might be based on whether or not the office staff was friendly or if their appointment was on time, but won't say anything about their final results. Another method is you might be referred to a surgeon by your primary care physician. Now keep that name on your list for further evaluation, but remember that even the less than best surgeons get plenty of referrals from their primary care colleagues. One other method people often use is word of mouth. Now this can be a great resource, especially if you know several people who went to the same surgeon and all had excellent results. Put that surgeon's name on your list. But I have one simple tactic that will help you build a short list of the best surgeons in your area. Even if you're new to the area, even if you have no idea about the surgeons available, even if you don't know anyone that has had a hip or knee replacement in your area. And I would do this simple tactic even if you were already referred to a surgeon by your PCP or by a friend. Here's what you do. Go to the people who see the results. That would be physical therapists. We see how people progress after surgery and we see the final results. So I would find around 5 physical therapy clinics in your general area. Call or email them and speak with as many physical therapists in each clinic as you can. Ask each therapist to name their top 3 surgeon choices if they had to get a total hip or knee replacement and why. Don't be afraid to ask. Physical therapists are a pretty helpful group. You can even ask them about a specific surgeon you might already be considering. Don't rely on the front desk personnel. They don't work with the patients, so they don't see the results. And they might just give you the name of a surgeon that refers frequently to the clinic because that's the first name that comes to mind. But I personally have treated tons of patients from surgeons who would not be the top choice for my own personal care. Build a list of names based on the responses from all the therapists you speak with. Very important, mark how many times the same name pops up. Very quickly, you'll build a short list of the best surgeons in your area. If you're in a smaller town, it's worth traveling to the nearest city for your joint replacement if that means getting the best surgeon. So once you have your short list of, say, 3 or 4 surgeons, you can start to evaluate each one more deeply with our surgeon questionnaire. If your original choice is not on that list, I would reconsider whether or not you should switch to a potentially better choice. The better prepared you are before surgery, the better results you can get after surgery, and learning how to choose the best surgeon significantly affects your final results. If you'd like to know how to evaluate the surgeons on your short list and what you can do both before and after a total hip or knee replacement to get the best results possible, let me know in the comments below, and I'll send you a link to our free total joint workshop and our surgeon questionnaire. The workshop is about 20 minutes long, and it will give you some great information on how to prepare for surgery and how to rehab your new joint after surgery to get the best results. The surgeon questionnaire is a great tool to evaluate each individual surgeon on your short list, so leave me a comment below if you'd like to receive these.